I want to welcome everyone who's joining us this evening from all over the world. This has been a really popular webinar, and it's great to see so many new faces at this webinar. So we'll be talking about bone health and vegans, the findings from the EPIC Oxford study, with one of the lead authors, Professor Tim Key from the University of Oxford. We wouldn't be able to host these webinars, these fortnightly webinars, without the help of our brilliant sponsors, veganfitness.com, who kindly give us the Zoom platform, and ProVeg International, which is doing amazing work to encourage the uptake of plant-based diets. Our webinars are also CPD accredited and CME accredited. They're CPD accredited by the British Society of Lifestyle Medicine, so everyone who attends will get a certificate in their inbox. And for those of you who haven't met me before on the webinars, my name is Rahini Bajekal, and I'm a nutritionist and head of communications at Plant-Based Health Professionals UK. We are a UK-based organisation that's dedicated to the promotion of sustainable plant-based diets, and membership is open to everyone. I'll share a little bit more about that soon. Our next webinar will be on the 10th of February, and it's with Dr. Adigo Atabo, talking about vitamin D and COVID-19, understanding the mechanistic links. So this is another really hot topic, and I do hope that many of you will be able to join us for this session in a couple of weeks. Again, do join us as a member if you're interested in education around plant-based diets or supporting our advocacy work. This is open to everyone, both healthcare professionals and non-healthcare professionals, and we have members from all over the world now. And you can visit pbhp.uk to subscribe to our free weekly newsletter and donate to support our webinar programme and other work via pbhp.uk/donate. We're also incredibly active on social media via Facebook, Instagram, and Twitter. Last but not least, this has been an incredible week for the team at Plant-Based Health Professionals UK, especially because we launched Plant-Based Health Online yesterday. This is the UK's first registered, CQC registered, online plant-based lifestyle medicine healthcare service, which is now live at pbho.uk. We've had tremendous support, and I want to thank everyone who has shared and spread the message about this new service with everyone. And do go and check out the website. We have lots of great information there, and I will send over a link in the follow-up email as well. So just to kick off today's webinar, I would love to welcome Professor Tim Key to give his presentation.
So good evening, everyone. I'm going to talk about vegetarian and vegan diets and fracture risk and our recent findings in the EPIC Oxford cohort. And this is mostly about a paper published late last year. The first author was Tammy Tong. So before I get on to the material about vegans, just a little bit about background about what is known about diet and fracture risk. And it's a strange story because despite sort of a lot of strong hypotheses and quite a lot of research, the picture hasn't been very clear about how diet does affect bone strength and fracture risk. The main things people have been interested in have been calcium and vitamin D, and to some extent protein. So for calcium, meta-analyses of trials giving calcium supplements showed that there was some reduction in risk for total invertebral fractures, but not for hip or other fractures. So that's supplements, whereas studies of dietary calcium didn't show clear associations. In fact, with the one exception, which I'll come to, of our work. Protein has been also considered in terms of in relation to bone health. And there has been a hypothesis that high protein intakes might be detrimental because they may increase calcium excretion. So, yeah, as I was saying, calcium meta-analyses have suggested that supplements may have some effect, whereas the studies of dietary calcium have not shown clear associations. Protein, the older studies suggested that high intakes might be detrimental because of increased calcium excretion. But other evidence has actually suggested that protein may have positive impacts on bone health. And then vitamin D, meta-analyses of trials giving supplements have shown that vitamin D alone did not have a clear benefit, whereas vitamin D in combination with calcium may. But in fact, none of these dietary factors have shown sort of crystal clear results for how they affect fracture risk. So it's a bit of a complicated background. The other very important diet-related factor that definitely affects fractures is body mass index, or BMI. This slide shows results from the Million Women study, which is also based in our unit in Oxford. And it shows that the picture is complicated. Obesity increases the risk for some types of fractures, but is clearly protective for others. On this slide, the top line is for fractures of the ankle, and there's a threefold increase in risk in the very obese women. Whereas if you look at the bottom two lines, which are wrist and hip, you can see there's a 50% or greater reduction in the risk of these fractures in the very obese women. So it is complicated, and BMI has to be considered carefully when we think about what the results in vegans mean. Now I'll say a little bit about our study, the EPIC Oxford study, the overall design, and a little bit about the dietary characteristics of the participants. This is a prospective cohort study based on men and women in the UK aged 20 plus. The majority are in fact women, about 75%. And recruitment started in 1993. Took a few years, and if you look on the left of the slide there, you can see the numbers in 4 diet groups. Meat eaters, fish eaters, who are people who don't eat any meat but do eat some fish, but they don't mostly eat a lot of fish, so they're a bit like vegetarians who will eat some fish. Nearly 19,000 vegetarians, so quite a good number. Total number of vegans 2,600. Although, as you'll see later, they don't all enter the main analysis. So quite good numbers of vegans, but we would certainly be better off if we had more vegans in the study. We also have blood for 20,000. Since recruitment, we've had repeat measures with questionnaires at 5, 10 and 15 years after the baseline. And the main follow-up is through record linkage through the NHS for cancers, hospital diagnoses and deaths. And the results I'll show today are with the linkage up to 2016, although that is continuing up until now. It's very important to consider, how long are the people we say vegetarians and vegans, sticking to that diet long term. And it looks as if they are, fairly well. When they joined the study, 85% of vegetarians and vegans combined had not eaten meat or fish for 5 years or more. And when we looked at 5 years after recruitment, you can see, if you look at the bottom right cell in the table, 85% of the vegetarians who joined the study was still vegetarian 5 years later. So there is some sort of, there's some regression, nearly 15% to eating some meat or fish. But it is a pretty stable categorization, which, I think it makes us easiest for us to pick things up. Whereas if you're measuring things like fat or fiber, it's much harder to characterize them long term. But these dietary categories are fairly stable. Moving on now to just say, a few things about what the people in our study eat, looking at key nutrients or nutrients that may be really important for fractures. This is calcium, and we've got the blocks on the left are what people said they were eating at baseline, and on the right, this is people when they filled in the repeat questionnaire at follow-up. This was in 2010. And in many of the slides, we use the same color coding, red for the meat eaters, blue for fish, and then shades of green for the vegetarians and vegans. At baseline, you can see that, as expected, really, calcium intake is quite high and doesn't vary between the non-vegan groups, but the vegans have a much lower calcium intake, and their mean was below the reference nutrient intake, which suggests at least some of them would be at risk of deficiency. At the follow-up 10 years in 2010, The vegans have gone up quite a lot. The other group's gone up slightly. Yeah, so it looks as if the vegan calcium intake's gone up and is now above the RNI. But it's very hard to estimate calcium intake, particularly in vegans, because a substantial amount of their calcium comes from fortified foods. And things like tofu may contain a lot of calcium, but some brands contain very little. And it's the same with other things, soya milk, etc. So I think, this is the estimates we have from the questionnaire and standard British food tables, but we're not very confident about how accurate they are for calcium. So it could be an under or overestimate in the vegans. But if it's roughly right, it suggests that during follow-up, calcium intake on average may be not too low to be worrying. This is protein intake. As expected, there's a graded decrease across the 4 diet groups, but the vegans are still well clear of the RNI. So, if these estimates are fairly accurate, it appears that few of the vegans should be at risk of protein deficiency. But I think we have to keep a bit of an open mind, because the type of protein is different, and the intakes of some of the essential amino acids are quite low in the vegans. We've looked at that separately. So the total protein intake looks okay, but I think we can't be completely confident yet whether there might be some risk. Vitamin D is almost impossible to estimate sort of meaningfully from diet, because the majority of it comes from exposure of the skin to sunshine. And also there's food fortification again, which makes it hard to get reliable dietary data. So it's better to use blood samples. Excuse me. And this slide shows measurements of vitamin D in a sample of over 2,000 people in our study. And you can see really very marked differences, with the average vitamin D in the vegans being substantially lower than that in the meat eating group. These are adjusted for the season and of the year of blood collection. In fact, the vegans, they did go up quite a lot in the summer, but didn't quite get to where the meat eaters were, but then they dropped down further in the winter. So if vitamin D is important for bone health, at these levels, then there's a potential risk there. The absolute levels, though, look reasonably high as a mean. It's generally thought that deficiency might sort of kick in below about 30 nanomoles per litre. So the average in the vegans is well above that. So, it's not clear whether we should be worried about the vitamin D or not. I just put in a slide of vitamin B12. It's not so clear whether this is important for bones, but I think it's always worth not forgetting it. And we see very large differences in B12 intake between the groups, as expected, because meat is a rich source. These estimates don't include supplements. This is from food, and it's a bit like calcium. It's quite hard to estimate B12 intake from food in vegans, because of some foods are fortified at quite high levels, others are not, but it's hard to capture that in a general questionnaire filled in by many people. But it appears that the intake from food in the vegans is sort of worryingly low, and we've looked in the blood samples and found about 50% of the vegans at the time of recruitment in our study did have levels that were low enough to be of concern. So, this could be a problem. Whether it's relevant for bone health, I'm not sure at the moment. Okay, it's just a slight switch now away from Epic Oxford just to another sample of people in the UK, and this is data from the UK Biobank. The reason I'm showing this is because UK Biobank has some measurements that we don't have in Epic Oxford, particularly physical measurements made at recruitment. And although the cohort didn't aim to recruit a lot of vegetarians, because it's got 500,000 people in it, there are reasonable numbers. So I'm just showing you a few results from Biobank. So this is body mass index. So if you look at the left here, this is body mass index in the 6 diet groups, with the meat eaters are on the left, the vegans are on the right. Anyway, you can see really as expected, the vegans have the lowest body mass index. You might also think the BMI in UK Biobank is quite high, even in the vegans, the mean's around 25. I think that's, it's a more recent cohort. The whole country has sort of got fatter and they're older than in Epic Oxford. So at recruitment in Epic Oxford, the vegans had a BMI of about 22, but the differences across the groups are fairly similar. And on the right, we've got body fat percent, which is something measured in Biobank, but not in Epic Oxford. And it shows a fairly similar pattern to BMI. So confirming the differences, it's not just driven by differences in muscle, for example, there is a clear difference in body fat percent. So if you look on the left, this is a measure of bone mineral density expressed as a T-score. In the 5 diet groups, and the vegans are the square on the right of that panel on the left, and they've clearly got the lowest heel bone mineral density. On the right panel on this slide, we've got the same results further adjusted for weight, which has a small effect, but not very big. So if you look at the bottom of the slide there, you can see the numbers. The number of vegetarians is quite big, over 4,000. Vegans is 222, which is not big, but it's big enough to give a fairly reliable mean. So in this is UK Biobank, separate vegans from in Epic Oxford, but pretty clear evidence here that on average, their heel bone mineral density is a little bit lower than that in the other groups. Grip strength and lean mass. So on the left panel, we've got grip strength, which goes down across the diet groups and is lowest in the vegans. It's not a huge difference, but it's a clear difference. And then lean body mass looks fairly similar. I mean, the lean mass, these are measurements made by a thing called bioimpedance, which is, it's not completely reliable. It's not the sort of best method, but I think it should be given the right pattern. So I think we have to bear these in mind as well, that at least in this sample of vegans in the UK Biobank, the vegans, they have a lower bone mineral density, slightly lower grip strength and lean body mass. I mean, the lean body mass is partly because they're thinner, but it's quite hard to sort of sort out whether they've sort of got a low lean mass for their BMI or not. So moving on finally to fractures, but before I get to the recent results, which I think are the most important, I just want to explain what we've been doing in Epic Oxford, because if you look up our papers, it might be a bit unclear. So we did write several papers on fracture risk in Epic Oxford over 10 years ago. And this is, at that time, we only had about 5 years. They were based on 5 years of follow-up in the cohort, therefore much smaller numbers. And the data on fractures was self-report. It was from a questionnaire that people filled in. So they just ticked the box if they'd had a fracture. So it's not as good as what we've got now. But I think it was probably, it's unlikely it was biased. It's just smaller sample and probably slightly less accurate reporting of fractures. So if you move on now, I'm just going to show you the results from that to sort of set the scene for what we've done more recently. This was the first paper, which was published there by Paul Appleby. If you look in the middle column, this shows the relative risk of fractures in the 4 diet groups, with the meat eaters as the reference group with a risk of 1.0. And if you go down to the vegans, you can see the risk is 1.30, so a 30% higher risk of fractures in the vegans. This is any type of fracture. And at the top, it shows there were 74 fractures in vegans. That's not very many. So it's not a great study, but it did suggest there was a just significant increase in risk in the vegans. And that estimate is adjusted for non-dietary factors, because when we're looking at the health of vegans, we want to sort of get rid of nuisance confounding factors like whether people smoke or alcohol and things like that, because they're not sort of fundamental parts of whether someone is a vegan or not. So we adjust for those, but we don't adjust for sort of strongly diet related factors. But then if you look at the right hand column there in the table, you can see that the risk for the vegans goes from a 30% increase to a 15% increase when we added dietary calcium into the model. So we sort of adjusted for calcium. So allowing for the fact that the vegans had a relatively low intake of calcium, it appeared that if you essentially compared meat eaters with vegans at the same level of calcium, the difference in risk in the vegans is no longer statistically significant, although it is still above 1, and the numbers are quite small. So it suggested, our conclusion was that the fracture risk didn't appear to differ between meat eaters, fish eaters, and vegetarians. The vegans had a higher risk, just significant, but it appeared that that was at least partly due to calcium. So we had a separate paper where we focused just on calcium. You have to be careful with this table because it's sort of in the reverse order to usual, because the reference group is the people with the highest calcium intake. If you look at the bottom row of the table, in the middle column for women, you can see those with a high calcium intake over 1200 or more milligrams a day. They're the reference group. And then as you go up the table, you can see that the risk of fractures goes up to 1.75 in the women with really quite a low intake of calcium. So that was a very strong result. In men, it's not significant, but the numbers of fractures in men were quite small, partly because there were fewer men. That is actually one of the few studies of calcium and fractures that's found this sort of relationship. Most similar, prospective studies haven't found a relationship, but we did. So we saw the conclusion was lower dietary calcium, there was a higher fracture risk, at least in women. And that time it appeared to be more in younger women. We also looked at vitamin D. We had funding to measure vitamin D in a subset, in a matched nested case control design, and the results were null. Compared with the top row, people with the lowest vitamin D in the blood, there was no significant difference in fracture risks going to a twice as high vitamin D. So, at that time, we didn't find any suggestion that vitamin D was important in our cohort. And I think this is the last one of these old papers. Physical activity we looked at. Here the results are just expressed as high versus low. So if you look at the the top row of results for bicycling, people cycling for 5 or more hours a week versus 0, there are quite large increase in risk, both in women and in men, with a risk of 2.3 in men. And you can see the other thing, other exercise sport, there's significant increases in risk. And there's also a significant increase for men in manual occupations. The only decrease in risk is for women in a standing occupation. People are interested in physical activity because it can help maintain strong bones. But, against that, physical activity increases the risk of people having accidents. And, it seems particularly cycling is risky. So, the point of showing you that really is that it's essential to adjust for physical activity when we look at fracture risk. Yeah, so finally, it's a bit of a long build up, but now we get to our recent paper published just a few months ago. The aim was to examine the risks of both total and site-specific fractures, which we weren't able to do before in our cohort. And the advantage now, compared with what we did before, we've got quite a long follow-up, and importantly, it's based on fractures recorded in hospital. So it's objective records, and there's no loss to follow-up in that everybody would end up in a British hospital and we'd get the data. This is just to sort of remind us what our classification of diet group is. We have a full food frequency questionnaire about frequencies of intake of 130 different types of foods and drinks, but the diet group is based on these 4 questions: meat, fish, dairy, and eggs. And you can see, I think I probably don't need to go through how we categorize them. You can see that here we've got, these are the numbers that actually entered the analysis, so they're a bit smaller than the total number recruited because of a few exclusions, but we've got just under 2,000 vegans in the analysis. The outcome is both total and site-specific fractures, and we put them in these broadish categories. So it's a sort of just one way of categorizing them, and you can see them arm, wrist, hip, leg, ankle, and other. And on average, we've got 17.5 years of follow-up now. The statistical model is a standard approach for this type of prospective study. So Cox proportional hazards regression with age as the underlying time variable. The analyses are stratified by sex, method of recruitment, and region. That's sort of a method of adjustment that's better for these variables. But then we've got further adjustment primarily for non-dietary factors that we don't want to influence the comparison between the diet groups. So year of recruitment, socio-demographic factors, lifestyle, which includes smoking, alcohol, and importantly, physical activity, height, some women-specific factors, and then body mass index. And it is sort of arguable about whether or not you should adjust for body mass index. We know the vegans are thinner, so if we don't adjust for body mass index, that's sort of the true experience of vegans. If they are thinner, therefore that affects their risk of some conditions. But if you want to know, do we think the vegan diet is affecting risk after allowing for that difference in body mass index, then it's more appropriate to adjust. So all the main results I'll show you are adjusted for body mass index, but I will show you one result to show you what happens if you don't adjust. And then I also show some further adjustments for dietary factors, calcium and protein. So these are really to try and explore whether the differences we see might be explained by those nutrients. Well, this slide is really the main results of the study. So this is risk for total fractures. We've got the diet groups on the left, and then the numbers of cases in the next column. And the numbers are now quite big, except for the vegans. So loads of fractures in meat eaters. The vegans 147. So that's quite a lot, but it would be definitely better if we had more. But that's what we've got. And you can see on the right-hand side of the hazard ratios, it's the risk, which is the risk of fractures compared to the meat eaters. And the plot in the center just plots those same numbers, visually. And what you can see is that there's no difference between the meat eaters and the fish eaters. The vegetarians have a risk of 1.09, so that's 9% higher risk, borderline significant. But the vegans have a risk of 1.43, so that's 43% increase, and that is highly significant. You can see the lower confidence interval is a long way from the reference line of 1. And at the bottom, these are relative risks, which some people criticize as hard to interpret. The blue writing at the bottom is the absolute difference, which is our estimate that it would mean about 20 more cases per 1,000 people in 10 years. Now I'll just go on to show you, the subgroups of fractures. The numbers now drop off quite a lot in the vegans, so the confidence intervals get wider and the estimates are less certain, but still interesting to see them. So for arm fractures, none of those differences are significant, but the highest risk is in the vegans. Wrist fractures, not so much difference, nothing significant there. Hip fractures, well, here both the fish eaters and the vegetarians are significantly higher than the meat eaters, with about a 25% higher risk. The vegans have a risk of 2.3, which is quite large. I think it's one of the largest risks we've seen in our sort of nutritional epidemiology for a dietary factor and an endpoint. So it's a big risk. It's highly statistically significant. And then moving on, we've got leg and ankle. Well, leg, vegans, only 18 fractures, but a relative risk of just over 2. So that's highly significant. ankle fractures, no difference between the groups. If you remember back to the beginning of the presentation, ankle fractures is the one that is particularly strongly related to obesity, with a higher risk in obese people. The vegans are the thinnest group here, so they should have a lower risk. They don't apparently have a lower risk, but that might be counteracting any other risk factor they may have. So this is just sort of other fractures grouped together. This is clavicle, rib, and vertebra, where the numbers are smaller. Again, the vegans do have a higher risk, only 23 fractures, but it is significantly higher. Okay, so this is the slide that just shows you what impact is BMI having in the model. If you look in the center column in this table, these are the results I've already shown you. So this is sort of our main statistical model, where we're adjusting for all the important non-dietary factors and body mass index. And I've already shown you the risks. So, for total fractures, vegans are 1.43. If we didn't adjust for body mass index, their risk would be 1.5. And there's a similar difference for hip. You can see the vegans 2.3, but it would have been 2.6. So what this is saying is that, on average for all the fractures here, the average effect of BMI is to be protective in the direction that the people with a higher BMI have a lower risk. And because the vegans are thinner, that gives them a higher risk. And if you put the body mass index in the model, that brings it down quite a bit, but leaves it still quite raised. Yeah, this one looks a bit more complicated, but it's showing the effects of what happens if we adjust for calcium and protein, or both calcium and protein. So the second column here, which is headed adjusted model, those are the results I've already shown you. So then if you look at the total fractures section, the third row down, vegans, you can see that as you go across the table, the risks do come down a bit, and particularly putting calcium in the model. So the risk goes from 1.43 down to 1.31 when you adjust for calcium. So that's saying that, the calcium must have some protective association in the data. And when you allow for the fact that the vegans have a lower calcium intake, their risk is attenuated a bit, but it's not attenuated very much. It still stays quite large. And a similar pattern for the hip fractures, which are shown at the bottom. And this is a sort of different way of getting at the same sort of question about calcium and protein. So if you look there at the third column, headed greater than or equal 700 milligrams a day of calcium, this is an analysis where we restrict the whole data set to people who, according to their questionnaire, are consuming that much calcium, which should be enough according to UK recommendations. And so you might hope that if you look at the vegans who are eating enough calcium, their increased risk of total or hip fractures would be, attenuated, if not removed. But in fact, it hardly changed at all. And the similar for protein, it doesn't have much effect. And even if you go to the right-hand column, so this is restricted to people who appear to have relatively high intakes of calcium and protein, but the vegans still have highly significant increases in risk. And as I said earlier on, our estimates of particularly calcium, I don't think they're very accurate for vegans, especially because of uncertainty about which foods are fortified and how much. But probably that group do have relatively high intakes of calcium, and it doesn't seem that's explaining it here. And I think this might be you might be getting exhausted with all this, but I think this is the last analysis slide. So this is going back to the main results, but just splitting them into men and women, or into thin versus heavier people. So if you look at the sort of second and third columns for men and women, if you go down to the bottom for hip fractures, you can see both women and men have a high risk of hip fractures in the vegans. It's not significant in the men, but the numbers of men are quite small and hip fractures are less common in men. So it's hard to say that that's null, it's not significant, but clearly the risk in women is highly significant. The right-hand side of the slide, I think, is quite important and interesting, that when we split by body mass index, you can see the column headed BMI less than 22.5. In them, the risk in vegans is even higher than what I've shown you before. So 1.66 for total fractures, over 3 for hip fractures, which is quite big. But this is thin people comparing thin vegans with thin meat eaters. So they're all quite thin. The final column right on the right hand side, this is heavier people, and there you can see the vegan is no longer, actually apologies, there's obviously a typo on the third row down, I've just noticed, but the decimal point's in the wrong place. But the vegans no longer have a significant risk of either total or hip fractures. On the other hand, if you're sort of looking carefully, you'll notice, surprisingly, the vegetarians in this one do have an increased risk of hip fractures. I mean, that sort of thing does happen. I'm showing you a large number of results, and some things do sort of bounce around by chance. So it's not obvious why that would be, that would happen, that people with a higher BMI would have a higher risk than the thinner ones, but that's how it is. Okay, so the strengths and limitations. Well, yeah, we've got a fairly large number of non-meat eaters, and we've certainly got a long follow-up, so that gives us big numbers. And as I've said, the outcomes were ascertained through the NHS, so they should be objective. Limitations, well, there's always lots of limitations. Yeah, we don't have sort of easily accessible detailed information on supplement use at baseline. And I mean, I showed you blood vitamin D in an earlier study, but we haven't had funding to do that yet in this current analysis. So, we don't know about what the vitamin D levels are like, but we can assume really from what we did before that the vegans do have low vitamin D, but we can't assess whether that might explain what's going on. And then measurement error, I've mentioned that before, but I think particularly for calcium, it's a bit uncertain how high the calcium intakes are in the vegans. I just wanted to mention one other study. I mean, I'm not aware of any other study that's looked exactly what we've done. The only other sort of well-known cohort in the world that has large numbers of vegans is the Adventist Health Study 2 based in California. They haven't published sort of yet anyway, an analysis as we've done it, but they did publish this a few years ago, which had some age-adjusted rates of hip fractures in 3 dietary groups. So if you look at the right-hand column there, you can see that compared with the non-vegetarians, the vegetarians and the vegans had substantially age-adjusted rates of hip fractures. It's not, those numbers are not fully adjusted for the things like we have done, like body mass index or physical activity or any of those things. That's not what they were sort of reporting. But it is sort of striking that there is an apparent large difference, but it's not quite testing the hypothesis. So our conclusions from what we've seen are, in our study in Epic Oxford, the vegans do have a higher risk of total and some site-specific fractures, especially hip fractures. The fish eaters and vegetarians, much smaller differences, but they appeared, they did have a significantly higher hip fracture risks, but, not sort of massively significantly. The differences, they appeared to be affected a bit, certainly by BMI and to a lesser extent by calcium. Protein, it wasn't clear it was having much impact. So, yeah, I think, from what we've done so far in this study, it doesn't particularly look as if it's just that the vegans are not getting enough calcium. It's partly because they tend to be thin, but even, if we, as I showed you, if we compare the thin vegans with the thin meat eaters, the vegans have a higher risk. So, it may be sort of exacerbated by being thin. And so the final thing, as usual, further work needed. It'd be good to measure vitamin D, etc. It could be that there's other things involved. So there's a hormone called insulin-like growth factor 1, which is sort of generally an anabolic hormone. And we've shown that vegans in our study have lower circulating insulin-like growth factor 1 than the other diet groups. And there's a little bit of evidence coming out that IGF-1 may indeed be important for fracture risk. And IGF-1, it seems to be particularly influenced by protein intake, but not so much the amount of protein, but the type of protein. So this is really a speculation on my behalf. We don't have any direct data, but it's something I'm interested in following up. So the situation, I think, is, what can we say now? Well, body mass index is clearly important. So, like everyone else, vegetarians and vegans should maintain a healthy body weight. And as well as not being too heavy, it's important not to be, too light. There are some risks for being extremely thin. For nutrients, well, again, like everyone else, vegetarians and vegans need to check that they have adequate intakes of all nutrients. And although we're not really sure yet, how important these are in terms of what we're seeing for fractures, it seems obvious that the vegans should take particular care for calcium, vitamin D, and B12, because all three of those in our study are low in the vegans. So worryingly low for vitamin B12, but also low for the others. And to get a good supply of those, it's a matter of choosing fortified foods and or suitable supplements. And I think final slide. Yeah, so thanks mainly, I suppose, to all the participants who've been in our study now for getting on for 30 years, filled in lots of questionnaires. We couldn't have done it without them. The team in Oxford, Tammy Tong, led this work, and we've had grants which supported this from the Medical Research Council and the Wellcome Trust. Happy to answer questions.
Firstly, thank you so much for that. I think everyone will agree on who's listening in that was fully worth the wait. And I know lots of people have been looking forward to this webinar for a really long time. So if you did miss a section or you have to leave now, I know we're past 8, then I will be sending out a recording. So don't worry about that. But we do have a few questions. I got a huge number of emails, so I won't be able to get through all the questions. But just to kick off the first question, one of the first things that came up was what you thought about different countries, different country-based guidance of calcium intake. Here in the UK, the RDA for adults, most adults is 700 milligrams, but in the USA and North America, I think it's 1,000 milligrams. So I was wondering what your thoughts might be around that.
Well, I don't think I have any sort of specific expertise. I'm aware that it does vary, and the UK has got one of the lowest recommendations. And I think that's why in that older study we did over 10 years ago, we had cut points at the sort of the UK intake and the American recommendation going up. And it suggests that, the intake, that the curve didn't flatten off till you got to over 1,000 milligrams a day in our study. But it's a strange situation because other cohorts have looked at calcium and fractures and not found any clear relationship at all. So I think I can't explain it, but our data do suggest calcium is important, and maybe you do need at least 1,000 milligrams.
Okay,
but really it's very difficult. I know expert committees sit on these things, but it's really hard to set dietary recommendations based on, you know, the sort of ultimate evidence that you need. You know, how do you actually get that data? So, you know, I don't know. I suppose the most reasonable thing is to look at the recommendations around the world and sort of, you know, you could decide that you're going to take an average or be cautious and take the highest one. I think that's all I can say, really. But I think certainly for calcium, it does appear, you know, it could be that our results are due to calcium. I think that's possible. You know, we've tried to adjust for it as carefully as we can. It does have some impact, but it doesn't anywhere near get rid of it. But, you know, it's maybe if we're measuring it really badly, then, you know, that would explain that. And that if we had really good measurements, we might find that vegans who have a really definitely high intake don't have an increase in risk. But I think you know, if calcium is really important, it would imply, I think, that most of our vegans are not getting enough calcium.
Okay.
And I mean, the intake at baseline was pretty shockingly, it was only 500 and something milligrams a day. But you know, it's a very tricky thing. I can remember soya milks back then in the 90s, which were fortified with calcium. If you finished the carton and then cut the top off and had a look in it, there was just a thick layer of sludge at the bottom. And I think all the calcium stayed in the packet and very little of it was consumed. I think it's better now, but, you know,
products have come a long way since then. We're lucky.
Yeah. Because I think that is another thing to bear in mind with our study, that it's getting historical in that people were recruited in the 90s. Probably some of the audience weren't born then. And, you know, what the risk we're seeing over sort of 17 years are partly built up probably by what happened to some of them in the 80s, you know, how they were living in the 80s and the 90s, etc. So it could be that things will change if we, you know, if we can do a new study of vegans, things could be a bit different, particularly if it was something like calcium, where 45.
Really great. That's really great to hear. There's so many questions about specific nutrients, but one that keeps coming up is about vitamin K and vitamin K2.
Okay, yeah.
So I would love if you could share your views on that.
Yeah. Well, unfortunately, you know, we didn't attempt to look at vitamin K. You know, I didn't show you any results on it. It's just something we haven't done yet, but we could, you know, we could see what we can do in the future. I'm not aware that, I mean, you know, maybe there's someone who knows more about it than me, but I know there's different forms of vitamin K, but one of the main forms is in vegetable oils, and I think the vegans should have a relatively high intake of that.
Sure, and we do have more information under the micronutrient section of the Plant-Based Health Professionals website. So for anyone who is interested, please do go and look at that, and you can drop me an email as well, and I will send over some more resources for anyone who is specifically interested. Another question that came up was about your views on animal protein and what you think about that in terms of whether that offers a protective benefit. And following on from that, have you examined specific food groups like cheat meat, so meat analogues, and legumes? There are other studies showing that they can be protective. So I was wondering about both of those questions down to protein again.
Well, yeah, I mean, we've done some analyses that weren't reported in the paper. You know, it's usually the case. It's certainly, we looked at protein, and it was in the direction of higher intakes, lower risk. Sure. Which is partly why we put some analyses of protein in the paper, which I've shown you, but it didn't seem to change. You know, it didn't seem to have much influence on the difference in risk between the diet groups. You know, we haven't looked in great detail at the types of protein. I am aware probably what you're audience person has mentioned, there was a paper from the Seventh-day Adventists where they looked separately in non-vegetarians and vegetarians and showed some evidence that more protein was associated with a lower risk. And so, even in the vegetarians, eating more protein, including things like legumes, was associated with lower risk. But we, as I showed you, when we adjust for total protein, it has not very much impact on the result. And by sort of compared with the RNI, it appears our vegans are getting enough protein. But it's a bit like calcium. People argue about the RNI for calcium, and people argue about the RNI for protein. It's possible, you could suggest it's too low, but according to the current UK recommendation, our vegans on average are not at risk of not getting enough protein. I mean, my particular interest, as I mentioned, about protein is related to IGF, because we're doing a lot of work on IGF, mostly in relation to cancer, and it's pretty clear high levels of IGF increase the risk for some types of cancer, including breast and prostate. And it's very clear that vegans have lower IGF, and non-vegans who consume more milk have higher IGF. So it seems that dairy protein has some effect on IGF, which might be big enough to be important. So that's something I think we're going to pursue. Could the difference be related to IGF? Because the other work on protein, I think it's not so clear, what the direct mechanism would be.
And I suppose,
but it's difficult because there's always a hypothesis. Nutrition is so complex that almost every nutrient, there is a hypothesis why this might be the key that explains what's going on. So, it's frustrating. We seem to move quite slowly, and I think it's pretty convincing to me that the vegans have a higher risk, but whether all vegans in the world have a higher risk is not shown. It could be that on average our group have got some sort of problem in their diet with calcium or something.
And you did touch on this in the study and the presentation. But why was it that men had no impact? Really, it was really the women that we saw the greatest.
Yeah. Well, I think I didn't really sort of go into the numbers very much, but 3/4 of the people in our study are women. So the numbers of men are much lower. So that immediately makes it less likely to find a significant result. And then also with fractures, now we've got quite long follow-up, particularly for hip fractures. They tend to occur in older people. And in older people, the risk's much higher in women than men, almost certainly because of hormones, because estrogen is protective and older women have a low estrogen. So, we've got more women in the study, and then at the older ages with hip fractures, almost all of them are in women. So the numbers of hip fractures in men are really quite small. So we don't see any significant association, but there could, if we had much more data, something might emerge. So I think I don't think you should draw the conclusion that there's nothing going on in men. I think the conclusion is we can't see anything going on in men because the study has quite low power in men.
And that's really helpful. And then one last nutrient I want to ask about, if that's okay, is about fiber.
Yeah.
It's come up a few times as well. I know that, looking at the fiber intakes, is it possible to deduce that people were following a healthier, more whole foods, plant-based style of eating, the ones who had a higher fiber intake, or was there anything else that you could share with us about fiber and the importance in the study?
I'm afraid I can't remember. I can't actually remember whether we looked at fiber and fractures. I mean, we probably did and didn't see anything. but it certainly, we didn't try putting it in the model. I mean, I'm not sure, is the person sort of suggesting that higher fiber would be indicating a healthier diet, therefore that would be beneficial?
Exactly, one that's that would be based around more, I guess, whole plant foods,
Yeah,
like whole grains, fruits and
yeah.
vegetables.
Well, I mean, the vegans, on average, the vegans have a substantially higher fiber intake than the other diet groups. So they're not sort of, on average, they're not sort of zero fiber, unhealthy vegans. You know, they do eat quite a lot of fiber. So, you know, I mean, we've looked at other sort of aspects of the diet, and it's sort of what you'd expect, I think, that the vegans, yeah, well, you know, they're thinner, they have a relatively lower alcohol intake, and they have a high fiber intake. They don't have an excessive intake of sugar or things like that. So, you know, because I know from talking to other people that, you know, people have suggested maybe the vegans in Epic Oxford don't follow a healthy diet. They, you know, maybe they eat a lot of junk food or something. But yeah, I don't think that's true. We did publish something about 2 years ago describing the food group intakes. So I could send you the reference, or you could look it up. But that does, you know, give a bit more detail about the actual intakes of foods in the different diet groups. And yeah, I'm not claiming they're sort of perfect, super, you know, I don't think they follow the perfect vegan diet, whatever that is, but I don't think they're sort of terrible. The main things that have stood out to me over the years is the vitamin B12 situation was quite shocking, really, that clearly they weren't getting enough vitamin B12, or some of them.
We've definitely seen the range of you know, fortified foods increase in terms of vitamin B12 fortified milks and plant yogurts and other meat analogues and so on. So hopefully, you know, people are also eating those as well as taking a reliable supplement as well. Now that I think that awareness has hopefully grown, particularly among vegans. But definitely highlighting how important that is and vitamin D supplementation as well, which of course we went into detail on in the presentation. So I think, you know, we've covered so many of the main questions. I know lots of people, I haven't been able to get to, I think there's at least 30 or 40 questions that I may not have been able to cover in the chat. But if people, you know, want to email us or ask anything, we're happy to pass on resources, but do go and check out the Plant-Based Health Professionals UK website. We have a lot of information on diet and nutrition, on following a healthy plant-based diet and supplementing. So go and have a look at those. And we also, I think this is our 22nd webinar. So if you want to see any of the previous recordings, then do join us as a member. And I want to thank you again, Professor Key. I know you've been overwhelmed with requests to talk about bone health and vegans, and thank you for speaking on our platform and dedicating your time to helping us get out this message, as there's lots of healthcare professionals listening in tonight. I will send the recording to everyone as well, and the certificate, so do watch out for that in your inbox.
Thank you. Yep.
Thank you. Good night, everyone.